Hello, I'm Dr. Richard Zarbo, Chairman of Pathology and Laboratory Medicine in the Henry Ford Health System. We are very pleased to share this video tour of the Surgical Pathology Core Laboratory. It is designed for 24-hour continuous flow operations to process over 180,000 unique specimens annually. These come from our 5 acute care hospitals, 40 medical centers, and 500 outreach clients across Southeast Michigan. Over 1,000 slides each day are delivered to our 50 subspecialized pathologists who provide accurate and rapid diagnoses for over 2,000 clinicians and who support 20 weekly tumor boards and numerous teaching conferences. This work is optimized for quality in our culture of lean continuous improvement and our ISO 15189 discipline, the only such laboratory in the state of Michigan.
I'm Natalie Carmo, Lead Pathologist Assistant at Henry Ford Hospital. Trained accessioners initiate the process of specimen registration and barcode generation, allowing for subsequent processes to become paperless. The barcoded assets are encoded with specific information that specifies the detailed work of each step for that asset and thus provides the basis for work standardization. Their work flows continuously to 12 PAs on this service from 6 a.m. to midnight so that very little is left over to the next morning. Residents assigned to this service only handle selected high-value specimens designated for them by chiefs. We begin with quality control checks of all assets to ensure patient and tissue identification. The barcoded system enables us to track assets in real time and to eliminate the paper requisition, which at this step might be contaminated. We use real-time digital imaging systems as standard work at each gross bench for detailed photo documentation for cynopathologists and to consult with off-site pathologists. Capturing photographic and radiographic images of clinical specimens enhances communication by documenting complex dissection and the tissue submitted, which helps eliminate diagnostic and patient safety errors. The end result is reduced description time for us and greater accuracy in specimen interpretation at microscopic sign-out for the pathologist. These images comprise a digital archive accessible by pathologists and residents when presenting at tumor boards, another time-saving, value-added benefit. Our focus on standardization protocols includes grossing templates, inking codes, and an intro-based electronic grossing manual for every possible scenario that's available at every gross bench. This ensures a consistent and complete dissection and staging of every specimen. All 12 of our board-certified PAs are involved in resident education and supervision. They oversee an online competency provided to all new trainees before rotations. Our team is active in lean continuous improvement, participating in daily management board huddles designed to identify current process defects and promote continuous improvements.
I'm Amanda Vitale, Histology Supervisor. The histology section employs over 50 technical staff, also standardized in a bar-coded operation. We achieve 24-hour continuous flow using state-of-the-art rapid microwave processors and automated stainers. We provide sophisticated services including direct immunofluorescence, a large menu of immunohistochemistry stains, chromogenic in situ hybridization, and FISH, as well as electron microscopy performed with a new fully digital Joule electron microscope. We are very excited to be adopting automated embedding in a partnership with Socorro Phenotech USA, as the only center designated the Socorro International Center of Excellence and Innovation. This is the beginning of our research goal to automate histology operations.
I'm Dr. Dhananjay Chitle, Vice Chair of Anatomic Pathology and Division Head of Molecular Pathology and Genomic Medicine. I'm going to briefly walk you through the case sign-out process. Our sign-out process is completely paperless, and each pathologist have their sign-out cockpits in their offices. The front-loader system drives individual assets, namely blocks and slides that are labeled with unique barcodes. Pathologist first scans the barcoded slide to bring up the case in the LIS, then image analysis software and Epic electronic medical record. After confirming patient identifiers, site, procedure, clinical information, gross description is correlated with digitally annotated specimen, faxitron images, and microscopic findings. A rich library of quick text helps pathologists fill out the report with pertinent findings seamlessly in the line diagnosis, microscopic description, and pertinent diagnostic comments. Then relevant clinical notes and radiology are reviewed and correlated with pathologic findings. For complex cases where special stains or molecular studies are required, the orders are requested electronically to avoid handwritten errors, keep audit trails that helps efficient laboratory workflow. Finally, for cancer staging using intuitive staging tool, pathologists stage the tumor that contains the latest AJCC staging parameters. Once all the diagnostic elements and clinical findings are woven to synthesize a complex written report, the final surgical pathology report is electronically signed out and released for clinicians to review. Many cases are double-read in consultations in addition to daily digital surgical pathology consensus conference through video conferencing streamed live to sustain high quality, accuracy, and continued medical education. Residents experience this comprehensive sign-out routine every day.
By leveraging engaged and motivated teams of people, intelligent processes, and enabling information technology, we are proud to have created a world-class surgical pathology laboratory. I believe you can see that relentlessly pursuing perfection is more than a motto, but a way of life here for the dedicated professional women and men of these Henry Ford laboratories.